Good afternoon, my name is Tsang-Wei too. This is the presentation of an IDC project at Howard University RCMI on the application of dynamic glucose-enhanced MRI of experimental TBI. In TBI, the mechanical impact usually damages the brain at the tissue junction where the inertial forces tear the brain tissue of different density to cause diffuse external injury. TBI causes two phases of head injury, including primary injury from the mechanical impact and the secondary injury that involves with the complications of inflammation and the metabolic disorders. A serious pathological event from systemic inflammation, hypotension, energy hyperactivity to hypoxia and hypoglycemia can cause further tissue damage and the widespread metabolic cascades and poor neurological outcomes. Currently, FDG PET is the major imaging modality that can be used to detect glucose uptake and metabolism in the brain. Studies have shown that PET can differentiate moderate TBI from severe TBI by looking into the uptake of lowering 18-labeled fluorodeoxyglucose. However, PET imaging is less sensitive to the milder form of TBI, which accounts for the majority of TBI cases. PET is low resolution that produce blurring glucose image and difficult to see changes. In this project, we are investigating an emerging MRI technique for TBI called CEST MRI. CEST detects the solute proton exchanges from a small pool to a larger pool of water proton by RF saturation of the proton signal at a specific chemical shift, such as in this case at 8.25 ppm. CEST MRI can observe the signal changes before and after saturation to estimate the amount of solute concentration at 8.25 ppm. A simple analysis of the MTR asymmetry will show the exchange CEST signal in the ZZ spectrum at 3.5 ppm. Here are the data that we performed in our lab on a phantom that contains 5 different glucose concentrations. You can see the exchange signal in the MTR asymmetry that can be used to derive a glucose image. The CEST concentration is clearly dependent to the glucose with a 99% linear to its concentrations. In the brain image, we analyzed the ZZ spectrum according to this equation, which utilized Lorentzian line fitting to decompose different transfer components in the brain, such as from the exogenous contrast agent, endogenous tissue contrast, MTC, and direct saturations. In this experiment, we imaged a rat brain with 3 different glucose phantoms and used the Lorentzian analysis to separate the signal from hydroxyl groups, amine, amide, and the multiple NOE groups in the brain tissue. As you can see in the glucose phantom, the majority of signal is from the hydroxyl groups at 1.2 ppm, where in the brain we can also see glucose signal but much less, also with the other MTC and the NOE component. We then performed a dynamic experiment that we injected 1 cc of D-glucose in a concentration of 0.5 gram per kilogram through the tail vein catheter. You can see the CEST contrast react the most at 1.2 ppm, which is from the hydroxyl groups of the injected glucose. The figure at the bottom shows the fitting profile in a specific time related to the injection in the cortex. It is very clear that the brain is reacting to the timing of glucose injection to show the dynamic profiles of glucose utilization in vivo. Then we generated experiment TBI on 5 rats and performed this dynamic glucose imaging to the brain. The result shows a very different profile of glucose utilization between the control brains and the TBI brain in different time points. In a normal brain, we saw a high uptake of injected glucose in the thalamus, but after TBI, the brain was less responsive to the glucose injection. These indicate the changes of glucose utilization, cerebral buffer in the injured brain that shows metabolic disorders, which is related to the mitochondrial dysfunction, blood-brain barrier damage, hypotension, and the perfusion changes that impair the glucose transport and metabolism in the brain. With the CEST MRI, we can now quantify the data from any brain region to show a region-specific alternations of glucose utilizations. In conclusion, Our results show a distinct pattern of the contrast enhancement between the injured rat brain and their baseline controls. Starting from the day 1 post-injury, the contrast enhancement were significantly decreased in the first 15 minutes of glucose injection. This suggests that the cerebral glucose transport and utilization were damaged in the TBI brains. Our data show that the dynamic CEST MRI is capable of detecting regional differences of glucose utilization following TBI. I'd like to thank our imaging core facility and also the administrative of HU RCMI program. Thank you for your attention.